Hi, I'm Dr. Jeff Rohde with Dental Compare. Today I'm with Ryan from DentalEZ. Ryan, thanks for joining us.
Thanks for having me.
We're always excited to see what DentalEZ has to offer, and at this trade show you're introducing the new compressor that you guys have.
Yeah, we came out with the Osprey, and for the last 40 years, Ramvac has been known throughout the industry as producing reliable, quality dry vacuum systems. But they really never had a compressor to kind of call their own, so they would have a true utility room offering. So what we wanted to do, we wanted to design a compressor that would offer them the same reliability, the same quality that made Ramvac what they are today. So what we did, we came out with the new Ramvac Osprey. So with the new design, what we wanted to do, we wanted to really emphasize on a couple things. Obviously, what we wanted to do is improve on the air output. We have a new rocking piston design head. The reason we wanted to increase on the capacity, the output capacity, is because with the new dental practices, more and more doctors these days are doing more things in-house, making their own teeth, they're even adding new labs, and with that requires air. Some of these CAD/CAM systems that they use to build teeth, they all run off air. Some are self-contained, have their own compressed air source. Others require clinical air. So what we wanted to do, we wanted to make sure that this was robust enough that would be able to handle that, plus allow the doctor to practice dentistry.
Right.
We really wanted to drive home the point of clean, dry air. We wanted to make sure that the air we were producing was dry, clean air. We have our basic filtration system. We have a 0.03 coalescing filter element. We have a dual desiccant dryer that will actually dry the air to negative 40 degrees Celsius pressure dew point. Our final filter is a 0.01 filter element. This is fine enough where we can capture mold spores, pollens, bacteria, even some viruses. There was a study done over in Denmark where they actually did the study of compressor hygiene, and the results from that study were pretty staggering. When they took random compressed air samples, they were actually found, in a lot of cases, some pretty dangerous bacteria such as E. coli, salmonella.
In the air that's coming out of the handpiece, for example.
Absolutely. It was air that was actually stored within the receiver of the tank.
Right.
So what we wanted to do was dry the air to a point where it inhibits the growth of that kind of bacteria. So with this filtration system that we have with the Osprey, this allows us to do that. So as a doctor, as you're in and you're performing dentistry on your patient, you know that you're not going to be blowing any kind of bacteria or dangerous kind of viruses into your patient's mouth. So it's dry, clean air.
Right. Well, also I'm drying off a prep to do some bonding too. I don't want any water contamination in that as well. I need dry air.
Exactly.
For a good.
You have a
bonding
loop-free
procedure.
handpiece.
Right.
You want to keep it that way.
Right. Exactly.
And now another great feature that we have the new C2 control. Basically what this does, it monitors the whole system for you. It tells you the system run hours. This will basically tell you right now that this is standby. It gives you what is in the tank as far as PSI. Gives you the actual, if the heads are running or not. In this case, they're off. Actual monitors the drying system. So it'll let you know which tower is actually doing the drying, which one's doing the purging. Let you know that the unloader valve is off or on. This is really important for service techs. The Osprey has an operating pressure of 115 PSI to 85 PSI, or vice versa, 85 to 115 PSI. Right. So your average regeneration time is basically how quickly your tank or how quickly your compressor builds from 85 to 115 PSI. Your drain time is what it takes for your compressor to drain from 115 down to 85 PSI. And if you have a greater number up here, if your regeneration time is greater than your drain time, well then you have a problem somewhere.
You're running out of air.
Exactly. Either the compressor's not sized properly or you have an air leak. Either way, it gives the service tech a nice place to start as far as, if he's trying to troubleshoot a compressor.
Right.
What this does is takes the last 60 cycles and it averages it out. It also monitors, it keeps the run hours of each head as well as the amp draw of each head, which again is a pretty good, all this helps the service tech in diagnosing problems within the clinic. Filter maintenance. It counts down from 700 hours. Then when you hit 700 hours, it's time to change out these particular filters. Dryer maintenance, same thing here. It's going to give you an indication, hey, look, it's time to change out the dryer. So it takes all the guesswork out. You know, a lot of dealers put doctors on maintenance schedules, but what this does is just takes all the guesswork out.
Right. I mean, it's essentially like attaching a computer to this thing to keep the finger on the pulse of what the machine's doing.
Exactly.
And it maintains it for you.
Correct. And we also offer the Allspray in a basic control platform, which is basically traditional pressure switch,
Right.
along with a contactor arrangement.
So the compressor might be probably the most underappreciated piece of equipment we have, and we can't do any work without it, but usually it's just in a closet somewhere, it's just kind of working and seeing it. I mean,
Out of sight, out of mind.
out of sight, out of mind.
Correct.
I know you guys have a pretty good warranty on this. What can a doctor expect as far as how long this machine will last and how well it's going to work for their practice?
We have a 6-year, 4,200-hour warranty on the Allspray, which is the best in the business. A lot of doctors take for granted their utility room, and without it, they don't practice dentistry. So, you know, it's really important that, you know, we have features like the S2 to actually give the doctor a heads up, you know, to give you a fault warning, you know, to give you maintenance reminders, you know, not to neglect your compressor. Because like I say, without it, you're not going to practice dentistry.
I mean, here it is. It's telling you, hey, it's time to change the filter. It's hard to miss that.
Exactly, exactly. So we're extremely happy. We developed a compressor that we feel marries real well with the Ramback dry vacuum system. And again, it's robust enough. The air output on the new Allspray, it produces an enormous amount of air, which will allow the doctor to keep up with his everyday dentistry, but still allow him to keep up with the components that you see doctors adding on to his practice.
That's great. Efficient, clean, dry. It's a workhorse.
It is. And we're extremely happy, we're extremely excited.
That's great. Ryan, thank you so much.
Hey, thank you very much.
The new Ramback Osprey from DentalEZ.